Public service announcement: Vocal abuse in teenagers. Just don't do it. By Ashley Freeman and Brantina Gordon.
Listen up, teens, because you could be abusing your voice. Vocal abuse is defined as a behavior that contributes to laryngeal damage or trauma. So some of these behaviors could include yelling, throat clearing, coughing, prolonged periods of vocal use, exposure to irritants, alcohol intake, and even dehydration. Yelling? Just don't do it.
I can almost see it, that dream I'm dreaming, but there's a voice inside my head saying you'll never reach it. Every step I'm taking, every move I make feels lost with no direction. My faith is shaking, but I gotta keep trying. Gotta keep my head held high.
Rachel, I think you've lost your voice.
So singing for long periods of time can cause the vocal folds to be strained and damaged, and this can lead to vocal fatigue. So just don't do it.
Hey, Quinn.
Smoking? We all know that smoking is an irritant that can dry out the vocal folds. So just don't do it.
Vocal behaviors could lead to laryngitis, which is inflammation of the voice box due to overuse, irritation, or infection. Nodules, which are usually benign and is a breakdown of the superficial layer of the lamina propria. Polyps, which are fluid-filled lesions that develop in the superficial layer of the lamina propria, but it also has its own blood supply. Cysts, which are benign mucus-filled lesions that are surrounded by a membrane. Ulcers, which are sores of the mucous membrane of the arytenoid processes. And Rinke's edema, which is buildup of fluid in the superficial layer of the lamina propria. So the recovery process varies from person to person, and there are different variables that can impact an individual's ability to recover. Some include the individual's ability to heal, the patient's state of mind, current demands of the patient's vocal use, and the patient's previous level of vocal use.
So here are the things that you should do to prevent vocal abuse. You should practice good vocal hygiene, such as limiting your intake of caffeine or alcohol, and drink plenty of water to make sure your vocal folds stay hydrated. You should practice vocal rest and try not to overuse your voice when you are singing, talking, screaming, or whispering. You should practice good behavioral therapy, such as breath control when talking or singing, and take medications or have surgery when needed if developed a vocal pathology due to vocal abuse.